Welcome back. Thank you for staying with KTN Prime. Let's now cross the borders into Uganda. And Uganda's Ministry of Health has announced a stockout of ARVs in the country. This follows reported cases from different health centers and regional hospitals across the country, with patients having to share drugs or even go without treatment. As KTN Serwanjja reports, the Ugandan government needs an additional 100 million Ugandan shillings to save the situation.
An estimated 750,000 HIV-positive patients could go without treatment in a month following the stockout of the antiretroviral drugs in Uganda. Civil society activists raised the red flag after shortages were reported in more than 6 districts without any intervention from government. According to USAID, the stockouts have been caused by the limited funding towards the HIV treatment.
The call is to the government of Uganda to consider increasing its budgetary allocation for HIV, AIDS and tuberculosis from the current 90 billion shillings to 180 billion Uganda shillings. We believe this can happen.
The Health Ministry, however, blames it to the depreciating shilling against the dollar.
There are some substantive issues, especially because of the escalation of the dollar rate, which could affect the amount of money in terms of dollars which we have for the medicine. Then this is a matter which is financial, and the Ministry of Finance is already been alerted.
The National Medical Stores, which is responsible for procuring the drug, says that they need an additional 100 billion Ugandan shillings to restock before the end of December. But as the Ugandan government ponders upon where to get the required additional funds, the World Health Organization is putting pressure to start all HIV-positive patients on treatment.
So our standard was CD4 cell count, and which was around 350. But now WHO recommends 500, but also other groups which must be automatically put on medicines. All pregnant women, all adolescents, all children, if they are found with HIV, all TB patients, whether their CD4 is high or low, they should get ARVs.
The government also blames the stockouts on patients who take more than what they need.
Medicine like maybe for 5 months, or you deceive that you have another patient and you take for them. Some of those medicines, you are not going to consume them. Then you are going to end up throwing them away, or they reach their expiry date. So medicines are life-saving interventions, and they have to be protected really.
In the interim, the government has resorted to providing an earlier pill, which was rejected by the patients on grounds of being too bitter. Serwanjja, KTN News.